Hi everybody, it's Dr. Karen. I just wanted to let everybody know that I was sleeved successfully on November 3rd. I was a trooper apparently because I had a lot of nausea related to the anesthetic they gave me. So I went in on the 3rd and I was sleeved by Dr. Malcolm Robinson at the Brigham and Women's Hospital in Boston, Mass. And now home after 3 days of being in the hospital. I'm feeling very, very good, even though I feel like crap, but much better than I expected to feel. Went into the hospital. I was prepped for a 7:30 a.m. procedure. Had a couple of problems because when they put the IV in, I had a really bad reaction, and I wasn't nervous. I just started to feel like I wanted to throw up. Luckily, the anesthesiologist wasn't very far away, and I was able to calm down with a little bit of medication. And they rolled me into the OR. All I remember is seeing the lights and talking to Chris and Elizabeth, my two anesthesiologists. I got to have a resident anesthesiologist, Elizabeth, who was really nice, and Chris was awesome. He was like very, very cool and nice and helped me through the whole anesthesia process. But all I really remember is them putting a mask over my face and telling me that take deep breaths. And then all of a sudden I was in the recovery room, and my husband was there, and the resident physician in the bariatric service was there saying I did great, textbook case. So I was like, yay! And then I went to sleep for like a few hours. Then the real trouble began because I went upstairs to my room in the tower, and when they brought me in, especially when I was going up in the elevator because it's 15 floors up, I felt incredibly nauseous, and I was definitely having a reaction to the anesthesia. So they gave me liquid ibuprofen, more Zofran, and the nursing staff was amazing, trying to make me more comfortable. My parents were there. They had to wait so many hours for me to come out of recovery, and I had already sent my husband home to take care of these fuzzballs. There's others that are surrounding me right now, but that's one of them. That's Franklin. My stay at the hospital was, after that, pretty easy. My pain levels kind of vacillated between a 2 and a 6, depending on how my incision felt. I have one large incision where they take out the stomach, and that one hurts the most. And I think it's just, they explained it to me, they pull it out, and sorry if this is too much information. They pull it out, and it might cause a little bit of bruising. So I was like, okay, that's fine. I can deal with that, right? That's totally fine. So they've given me a lot of pain medication. I was able to get off my IV toward the end of Friday in terms of having it hooked up and dripping. And I started, my first food that I could eat was chicken broth, which was fine. I had trouble getting all my fluids down, which I guess is not surprising because I just was feeling so tired. And I don't think I felt any pain. Like, I certainly didn't feel my new sleeve at all. I just felt that one big incision, and it started to really bug me. So they put me on Oxy, which is not my favorite drug, and I kind of wish there was something else, but it does what it's supposed to do, which is to make you relax and take away the kind of pain you have. So I had all that done, and Saturday, which was yesterday, they allowed me to go home, and I was ready because I had drank 2 protein shakes, which was a requirement for me to be released, and I also was walking quite a bit. I was up the day of my surgery. I was able to walk 2 laps around the ward that I'm in, or was in. I was also very fortunate that I had a roommate, Beverly. She's awesome, and I didn't know what the experience would be like, but it was nice to have someone in the room who was really nice to talk to, and we didn't have the same procedures done, but it was great to have sort of a buddy. We exchanged phone numbers and everything, so it was nice to make a friend in the hospital. Nurses were amazing. The PCAs are great. I got to wear my nightgown on the last day. I wore a Johnny for the other days because I had to carry around a heart monitor, and it was just easier to get it in the pocket of the Johnny rather than trying to figure out how to clip it on my nightgown. And I was able to dress myself. I was able to walk down instead of being wheeled out of the hospital. And then I came home. My first night was pretty good. I am struggling to get the fluids down. I've been asked to drink really, a huge amount of fluid because dehydration is the top reason you're rehospitalized after a sleeve. So I have been trying to drink that, and then I'm also supposed to have upwards of 60 grams of protein per day. I am not making that yet. I'm trying to get at least a Premier protein shake down, if not 2 during the day. There are 30 grams of protein in each one of those, so it's less fluid, but more bang for your buck. And I've been using Crystal Light to make my water taste a little better. I like the orange and fruit punch ones. Other than that, I've been trying to rest, take my medication, and also just try to focus on being positive. I mean, this has been such an amazing restart of my life, and I'm very fortunate that I was able to have this done, that I have insurance to cover it, and that I have a wonderful team of people around me, not just my family, but the medical staff that helped me do this. Dr. Robinson was great. I only saw him a couple of times because I was so sick when I originally saw him. I was like, great. All he remembers is I'm that person who got nauseous. Gross. But, everything went well. The procedure went perfectly, and I couldn't ask for a better outcome. So now I just have to watch my pain levels, make sure I don't get dehydrated, and just stay home and heal. I have 2 weeks of vacation time I'm using to take off for my recovery, and I'm going to use as much as I need of it and see how I do. So that's about it. If you're thinking about having the gastric sleeve and the surgery part scares you, don't worry. You can get through it. It might seem scary, and it is somewhat scary, but for me, I was able to feel like, hey, this is the start of my new life. I'm celebrating a new birthday. And this is, the beginning of something that's amazing. I wouldn't trade it for anything. So I'll keep everyone updated on how I'm doing, and I will probably upload a video periodically as I make progress. So thanks so much for watching my channel and supporting me all the way. I really do appreciate it. And again, negative comments on my video blog are totally uncool, and you will be referred to mental health services if you do it. So don't be a troll. Bye, everybody.